Okay. Hi there. We're going to be doing a Foley placement now procedure. Just to let you know, at one point we'll be pausing this as we're going to be moving from a female to a male with the care. So we'll start out with Mrs. Green, and I'll start out as we normally would for any kind of competency. One moment. Hello, Mrs. Green. How are you this morning? My name is John. I'm your nurse today. Just wondering if the doctor's been in to talk to you about a Foley catheter placement, and the patient indicates yes by head moving up and down. May I check your name band, please? Okay, I see you're Mrs. Green. Okay. Have you had a catheter placed before? That's always an important thing to ask to see where you need to go with patient care. As far as education is concerned. The patient indicates that they've had a Foley catheter placement before. Okay, so I will begin to get things prepared for the procedure, okay? So I step back, I will do hand hygiene. I will put on clean gloves. And what I've asked students to consider, if patient is able to tolerate, female patient is able to tolerate the placement of a pillow under their bottom in order to make visualization a little bit easier for the catheter placement. I've already placed a pillow underneath Mrs. Green for purposes of this demonstration. So before I do any sort of opening of the packaging and whatnot, I will take a look at patient's area. I will palpate bladder. Ma'am, I'm going to check your bladder for you for distension. I'm also going to look at the perineal area for any places of concern, and I'm going to do perineal care. It's important to do that, obviously, to get all the microbes out of the area as much as possible to make sure you have a good and sterile situation going on moving forward, or at least as clean on the outside as you possibly can. Okay, so I'm going to provide for privacy, and I am going to come back over it. I'm going to get my kit going and place it over here. I can take off my gloves now, and I can do hand hygiene again and begin moving forward, opening up my kit. So we have our kit like this, and we have our first tab, and that always goes away from us. I ask the students to remember that brand new kits are going to be with the snapback of the paper, so be careful of that as well. There's no reason to be in a rush to get things set up. Okay. It's always good to try to have the work as close as you can to the situation as well. For this gal here, we can also, realistically, she'd have to maybe open her legs up a little bit, and that she can be assisted with that in order for the area to be a good area to use. Okay. Take my gloves. Come to the edge of the counter, as I hit my tabletop, that is. I have plenty of room to open my gloves to supplies. Cuff in. Again, as this being a sterile procedure, students are to be mindful of any kind of break in sterility. If it's done and recognized and corrected, then we move forward. If not, it's something that a learning experience needs to be done. Okay, so now that we have our gloves on, be mindful of the sterile situation. We can get our drape out. Again, using the shiny side down for absorbency purposes, and then we move into the field. Be mindful not to get our gloves on the patient at all. Speaking to patient for comfort and saying things are good, how are you doing? Comforting words, getting that into place. At this point, we're not indicated that student needs to use this drape around the perineal area, so we can set that aside gently. For purposes of demonstration, using equipment for the mannequin, we cannot use betadine, so these are alcohol swabs. What I encourage students to do is to set up everything in their sterile box, displacing things that aren't necessary in order to bring the box over to patient, so you have it all together in that one place at the end. As far as taking the sheath off of the catheter, I'm teaching students to gently walk up the catheter so you end up having a good grasp of the tip. At this point, you can lube the tip, simulate lubrication, and then placing that into the box as to not cause a break. The sterility with the tube hitting anything going over to patient. The next part of the procedure will be to open up your sticks. In real life, it would be betadine, as again, as indicated, these would be alcohol swabs. And the last thing would be to connect your syringe that you would use the sterile water to infuse the balloon on the catheter. The catheter balloon is not to be tested. Best practices are indicating that it would it might degrade the balloon, practicing outside of the body, and or the solution may not come totally out of the balloon and causing trauma to patient. For notation purposes, 14 French Foley is indicated here and on the packaging on the outside of the kit, and it says here 5 to 10 mLs of solution into the balloon. So that's what we will do. Okay, so now moving over to patient, I will designate a hand for clean and another hand for sterile. So coming over, I will put this into the space, not breaking sterility. And this will be my clean hand, and for ladies, we will open up the labia and we will take a swab at a time. And the first move is to clean the area away from the labia away from you, and then the second would be the labia closest to you, and the third would be going straight down the middle to the area. Okay. This will be a point in time where you would instruct the patient to take a deep breath and to realize the catheter is going to be placed, and continue on. As I indicated before, we switched the member out to indicate how to clean the penis good for entry of the catheter. I've instructed students to be mindful of a patient's age, a male patient's age, because there may be some BPH going on that may or may not be a diagnosis for comfort of placement of Foley. Pillow is out from underneath because this is no longer a female patient. Sir, we're going to clean the penis now and place the catheter. Okay, so what you do in this case, just like as if it was the female, you want to designate your hand either clean or sterile. So this is what we do, and you place your hand around the penis and hold it upright and leave it there for the procedure. Okay. The first swab would be to go around the tip of the penis as such to the top of the meatus, and then you would let go of your swab. And then the second one would be the same. Okay. And then the third, lastly, will be this. And for cleaning either around the labia and or the penis, the purpose is simply this. What if you were to go like this to the side, or even with the labia? That's still sterile. So there's no reason to step back and say, oh, I have to do everything over again, okay? Sir, I'm going to place the catheter now, so take a deep breath, try to relax. And if you feel a lot of pain, let me know. Otherwise, it should only be some uncomfortable pressure until you feel relief from the catheter being placed into the bladder. Okay, as before, when you see indications of a little bit of urine, you go about an inch longer, and then you can start to instill your fluid into the catheter. So we're going to do that now, sir. Let me know if you feel anything that's out of the ordinary or any painful situation. So 5 to 10, I'm just going to simply put the full amount in. Okay? Then I can take off the syringe immediately as to not extract fluid back into the syringe for backflow. And then pull this back gently in order to secure and make sure that the balloon is at the eye of the bladder. For all intents and purposes, this bag should be filling up with urine. And then there's two things that they do as far as care of the patient moving forward, and that's the placement of the securement device and or tape onto the thigh to allow for any kind of pulling or tugging on the catheter at that point. And then lastly, they're instructed to verbalize and or physically place the urine bag onto the frame of the bed and no movable parts such as the side rail or any of that there. Okay. As far as the indications for documentation, it would be how the patient tolerated the procedure, the color, quantity, and consistency of the urine, if there was anything of concern regarding the perineal area, and that's about it. So side rails would be up as the end with it, of all procedures, and call lighting reach, and taking care of patients as far as comfortable. Okay, thank you very much.